Okay. Well, I'll give you a little bit of a snapshot into what a day is like for me as an eating disorders registered dietitian. First, on Monday, Wednesday, Fridays, I work for Foundation, the International Association of Eating Disorders Professionals, and I'm the director of certification, which means I coordinate the efforts of the certifying the therapists, medical providers, registered dietitians, and registered nurses who specialize in eating disorders treatment, as well as the training that needs to occur for someone to become a specialist. But on Tuesdays and Thursdays, which is what I think you're kind of looking to, is like, what would my life be if I became an eating disorders dietitian? I'm in private practice those days. Sorry. And so today's a Thursday, so I'll just kind of walk you through what happened today. Today, I started my morning at 7:30. My first client was a 7.5-year-old. I've been seeing her for a year and a half. Started with hiding food, body image issues, poor growth. And now is diagnosed with RFID, avoidant restrictive food intake disorder. And I meet with her and her mom. She's young. She needs her mom's help. Last year she needed help in the lunchroom at school, and so mom would actually take her to a quiet area at the school, like the library, and have lunch with her there so that she could get her nutrition in. This year, she is starting on her own, and she's doing really well. Tomorrow, she's actually going to try not bringing her own lunch because it's Pizza Hut day, but she's really kind of nervous about that. My next client was a 21-year-old college male struggling with binge eating disorder, and his binging, that's what we're focusing on mostly, is decreasing the binging. And just to say, I will never treat someone with an eating disorder without a therapist on board. So when he's telling me about his binges, I can help unpack what might have led to that in terms of not eating enough, fueling his body well enough so that when he does start to eat, he can't stop. But if there's an emotional component to that, which most often there is, then I pass that information along to the therapist so that then they can do that kind of work. My next client was a dancer, and she is a professional dancer as well as a personal trainer and struggling with binge eating disorder and weight gain because of that. So again, getting her in with a therapist. A lot of times they'll start with us as dietitians because they think we just need to help them with their food and everything will be okay. Which is a great place to start, but we as dietitians really need to get them in with a therapist. So over time, actually, I've been working with her about 5 months, and she's doing great. I use an app that helps kind of her tell me the symptoms that she's having, any binge symptoms, any thoughts or logs or feelings, and then it also administers the EPSI, which is a questionnaire that looks at restrictive, excessive exercise, and gives me graphs and charts that can help me know that someone is decreasing their symptoms and doing better. Then we decrease the frequency. So I'm only seeing her once a month now. My last one that I'll talk about is a 58-year-old who has been struggling with anorexia since the age of 12. She hasn't had treatment for it. She feels a lot of shame. She's doing chewing and spitting at this point, which is a higher level of pathology. And she was able to open up to her husband for the first time in her life that she's struggling with this eating disorder. Bouts of bulimia throughout those years. Medical complications are there. She's still appropriate for outpatient care, but my job is to empathetically help her understand that how the malnutrition is affecting her body and help her make those little changes to increase her calorie level. Because she would, anything over 1,200, she would chew and spit. And she's an older client. And so back in the day, it was a low fat or fat free diet. So anything that had fat in it, she's also spitting. So that's a summary of a day in my life.